Bread of Healing is a clinic that provides a primary health care home for people without insurance. The mission is to deliver quality health care to people without any health care, to treat everybody equally and to prove and show that people are of equal value, and to suffer with an illness is not something that you have to do, that we need to service people and take care of all of humankind, and to know that we love one another.
We're a primary care medical home, so we have dental care, we have psychiatric and counseling services, we have vision and ophthalmology specialty care, and wraparound social services.
We have behavioral health counselors that are at all 3 locations, making sure that they feel heard, that they feel understood, and that they feel advocated for in terms of what their needs are.
We have an endocrinologist over there, we have podiatry and neurology. So all these people volunteer. It got started just very innocently. I was a parish nurse here at Cross Lutheran Church, and for about 8 hours a week, and the other time was spent in the emergency room at a local hospital. I was seeing a number of people both here and in the emergency room that we had chronic illnesses or needed to be followed up by doctors, needed prescriptions filled and stuff, and they had no way of doing it, and they would end up back in the ER, or I couldn't help them here at the church. There was also a resident at the hospital. Well, Dr. Jackson knew what I was doing, knew her, and introduced us in 1999, and we looked at each other and said, what do we do? What do we do? And finally she said, all right, in January you and I are going to start seeing patients. So she took her credit card and she took it over to the local pharmacy at the hospital, left it there, and then would write prescriptions with patients we saw, send them there to be filled, and it would be charged to her charge card. Well, the day we saw 31 patients in one day, we thought, oh, this is getting awful big. We know the need's there, but I don't know what we're going to do. And we started asking around. We asked other churches, we asked other facilities, we asked the hospital systems, and then it began to grow. You know, we looked very hard at scheduling systems and how we were going to do this, and we had no opportunity to be able to purchase something that was already produced. It was very, very expensive, and we didn't know what to do.
Rick approached me and said, hey, by the way, I've got this issue. We're using a free scheduling platform. It's not working for us. There's a lot of ads. We love MyHealthDirect and what MyHealthDirect is doing for Bread of Healing already. Is there any way that we could actually use MyHealthDirect for scheduling? Not just for getting appointments, but as our clinic scheduling tool. So we talked about it a little bit, and I ran it up the flagpole and was given the green light to, yes, let's go ahead.
We were thrilled to be able to work with them and to provide for them, for no cost, access to a system that will allow them to keep track of the providers when they're there, the patients that they've seen, essentially a full appointment schedule for Bread of Healing.
It's been a blessing ever since, because they've gone over and above in trying to help us create a scheduling system that crosses lines with specialties along with other 3 clinics to be able to schedule folks in.
I think the impact has been that now we have a solid way to collect data in terms of new referrals, ongoing therapy, how long people have been involved, how long people have been seeing the same counselor, how frequently they're making their appointments.
It's helped our granting program, it's helped our patients because it's more organized. There's a text system so that when the patient is, before the patient's appointment, they'll get a text if they have a cell phone to let them know that they should come in. It's just been wonderful.
One of the things that we find is that people that are uninsured and don't feel well are pretty scared, and they are hesitant to get started with their care, and being able to have a resource like MyHealthDirect to identify a place where people can get primary care close to their homes, close to their place of work, or wherever their choice is, was an enormous tool to be able to get people to the correct care at the right time.